Welcome, Charlene Gordon. Please take it away.
All righty. So, everyone, my name is Charlene Gordon. I'm a public health educator, level 3 from the New York City Department of Health. And that's my contact information if you need to reach out to me. And I'm here today to just kind of give you a quick little overview of the health department, myself, and where I currently work within the health department. So just to give you some background, the New York City Department of Health and Mental Hygiene is one of the world's oldest and largest public health agencies. Its mission is to protect and promote the health of all New Yorkers, and it has an annual budget of 1.6 million with more than 6,000 employees who work within all 5 boroughs. Our commissioner, which you all may have seen him on the news and in different ways, his name is Dave
On TV
Chosky.
and commercials.
And the commercials, yes, he is the person that you see in all those commercials telling you about the vaccine, about flu shots, etc. Yes, that's our commissioner. And the health department also have a New York City Board of Health, which it's about 11 members to it, including the commissioner. And their job is basically, they're pretty much appointed by the mayor, and they serve about 6 years on this board, and their role is basically to implement all those New York City health codes. Does anyone remember the last health code that you've heard in the news? Does anyone remember any of the health code that you've heard in the news?
You know what? I bet I've heard of it, but I didn't know that it was part of the health code.
Yeah, so the one I think recently was about the restaurants, about trans fat. So those are the members who actually were part of the discussion of it. That's what their job is. They're all from different discipline within health and medicine. So that's what the board is for, give advice and implement all the New York City Health Code. So this is the health department organization chart. It is great to actually take a look at it, and especially if you're interested in any areas within health. It is broken down in different components. As you see, there's folks in mental health. You have individuals for environmental health, like where I work. You also have divisions on disease control. You have your child health focus. You have the Center for Health Equity. Those are the individuals that work out in those satellite locations that you hear about in different neighborhoods. And you have our external affairs that, if you need to get a speaker from someone from the health department, or if you are doing some kind of media information, those are that's the bureau that you would actually reach out. And of course, to the right, or maybe to your left, you have your administrative areas. So that's the health department. And in the center, we have now a first deputy commissioner for equity. And you also have seen him on the news talking about flu shots. So that's the organization chart. Please take a look. I put the actually link here so that you can actually take a look and see how the health department is divided and which programs are under who. Okay, so the health department has our core values, their mission, the vision, and strategy for 2020-2021. Is the core values talking about science, equity, and compassion. Mission is to protect, of course, I mentioned it, protect and promote the health of all New Yorkers. And our vision is a city where all New Yorkers can realize their full health potential, regardless of who they are, where they are from, or where they live. And it also has some strategies. The health department must meet the moment. The health department is experiencing multiple health crises, as you can see, on COVID. We also about the pandemic, racism, and unprecedented social and economic instability at the moment. So some more information about its core values, the mission, the vision, and strategy for this year. Here is where you can actually locate it. So I found that it's important for you to actually understand ways to understand the health department. Okay, so the health department also has this other area, which is called the Fund for Public Health NYC, and they were created in 2002. It's an independent nonprofit organization, which their purpose is to connect the health department to private sectors, those funders, and greater philanthropic communities, and their work is to promote healthy behaviors, educate community, and to spread the infectious diseases. They raised money. They raised over 500 millions in public and private fundings on various projects. And what I did was I put the link here that you can always go on their website and see what they're working on, more information on them, and to see maybe something that you may be interested in. So this is the health department website that you could go on. You see all the different things that you may have heard on the news or around on health. It's there. We also have our New York City health data, and I know for some of the classes that you may be getting that you need some data, so you could always go on the health department website to get the data. For this PowerPoint presentation, I provided to Dr. Collins, who will share that with you. And if you're interested in career as working with the health department or even the fund, there are also career opportunities, and here are the links to them. And in some of these positions within city government, you somehow have to be tied to taking a city exam. So it's great to, visit the website, take a look and see what of interest, and to see if any of those exams may be linked to some of the employment titles that you may be interested in joining the city about. So here is the information. Okay, so now I'm going to talk about me as far as my journey here working at Department of Health. Just a little background on me. So I have a bachelor's degree in biology from Pace University in New York City here in downtown Manhattan. And I have a master's in public administration. My focus is on health administration from Long Island University. I received my degree in 2004. Then in 1994, I started the city. I worked with the Bureau of Immunization. Then I worked out in those satellites clinics where we offered vaccinations of all kinds to parents, seniors who needs to be vaccinated. So one of the job that I had was to make sure we're doing some education to individuals who are in need of vaccination. Some of the individuals who visit us are young children, and they may be new to the country and they need to be vaccinated. So my role there was to, one, educate the parents, review if they've had any previous immunization documentation, and also to inoculating those individuals. So I was actually trained by one of our physicians in doing vaccination. So I did this for about 2.5 years, and then I left, and not left, but got promoted to another position within the Bureau, where I coordinated their, they have an influenza, they need an influenza coordinator. So my job was basically the city used to work with the different senior center, any programs to deal with older adults. And my job was just to coordinate the scheduling, making sure that there's staff available to attend, doing orientation, and promoting, older adults getting vaccinated. And also too, in addition to overseeing some of those immunization clinics, in, just making sure that people do get vaccinated. So that was what I did. So then I left there and I went on to work with the Bureau of Healthcare Axis. And there I started in 1999. And my role there was basically to be like a marketing monitor. And what we did was I worked in the compliance department. So our job is to, at the time, any individuals who just who has Medicaid has now to or mandate are now mandated to be on a health plan. So my job was to making sure that those individuals who are participating in those programs are actually educating the community with the right information. As I said, I work in the compliance unit, so there are things that they have to are mandated to do. So that was what I had to do. And also, two, they have to report to us where they're actually going to be, getting those consumers onto their health plans. So they have to report that. So also, two, visiting all 5 boroughs and traveling and doing that work. So those are some of the things I did. I mean, there are other things that I did, but it was around mostly on doing those marketing monitoring. Then after I graduated, received my master's degree, moved on and started to work here at the lead, it was actually the lead poison prevention program. And then our name change went to Healthy Homes program. And within that, we're now called Environmental Exposure Assessment and Education Program. And within there, I represent the Education and Community Partnership Unit, and you'll see some of the things that we do within the program. So in the environmental disease and injury prevention, their mission is to prevent environmental disease and injury in homes and communities and the workplace, and to protect the health by promoting healthy environments and health equity. The Bureau's programs included our Healthy Homes program. They have about 5 programs. So we have the Office of Environmental Investigation. We also have Environmental Exposure and Assessment Education, which I represent. And we have our Poison Control Center and our Injury and Violence Prevention. Okay, so these are all programs that's under the Bureau, and they all focus on those missions. So in the Healthy Homes program, they have inspectors who investigate peeling paint complaints, unsafe work practice complaints, sweeps and embargo inspection of retail businesses with products to prevent with preview of identifying with high lead levels. And these are complaints that they've got from anyone calling 311, and it's sent to them. In addition to that, they have a case coordinating services for lead poisoned children, lead poisoned pregnant women, and their newborns. So they're a team of nurses and other staff who coordinate the care. In addition, they also have referrals for integrated pest management, who provide families if residents. Um, I'm sorry sorry about this. Sorry about that. Oops. I'm gonna go back. Sorry.
No worries.
Okay. Hold on. Hold on a second. Yes, back to where we are. So they also, do referrals for integrated pest management. Like say, for instance, in a family has someone in the household that has persistent asthma, and the inspector goes in and see there's mice and roaches, so they do inspection in the homes. We also have our Office of Environmental Investigation, who also has a team of inspectors who's concerned about environmental conditions in the home. They do foodborne illness outbreaks and other agency consumer sweep. So that's what they do. Okay. We also have our Poison Control Center, which is provide comprehensive services for, prevention and treatment to all New Yorkers. They're 24/7, 7 days a week. You get a live person on the phone that you can speak to, and all the calls are free, they're confidential. And in addition to the calls, they also have staff that goes out in the community and do presentations. They do it in New York, Nassau, Suffolk, and Westchester counties. So that's the Poison Center. And lastly, we have our injury and violence prevention program, which priorities include preventing burden of injuries, as far as falls prevention, and reducing their disparities, traffic-related injuries, falls among older adults, child injuries, interpersonal and intimate partner violence, and suicide. So those are things that they work on. So as I mentioned, I work in the environmental exposure and assessment education unit, and within there I represent the education community partnership unit, and our role is to provide education and resources to New Yorkers on environmental health hazards in the home, workplace, and the community. So here are some of the things education that we do. We do for now, we are doing these virtual presentations. We do it to parents. We do to senior centers. We do staff trainings for different organizations. We also have professional trainings for specific groups. So, agency staff that work with specific group, like one agency staff working with older adults or agency staff with families with children. So that's what our professional training's about. We also have educational materials, which I'll share with you later. We also have an information line that the public can call and ask questions, and we'll be able to answer. And we also do, if you've seen people at different times, they're celebrating different things and they have individuals, they're tabling. So we go out to those tablings and share our educational materials and answer questions for the community. So those are talks that we cover. Our presentations are in English, Spanish, Bengali, and Russian. We have one educator who speaks Bengali and Russian, and we have about 2 individuals who speak Spanish, and everyone else from the team speaks English. So yes, so you see the topics we cover on lead poisoning, we have mold, pests, it's more environmental topics in the home. And we have this one topic called falls prevention for older adults, to educate our older adults. And we also have cooking safely without lead. So talking about some ceramics, spices, so that's what that presentation covers. And of course, about window guards, you heard on, I think it was last week, about a child falling out to the window as a result of, not proper gear covering the window. So yes, we talk about window guards. Okay, so we also, here is our educational materials. So, we have some of these materials in 14 different languages. They are offered online. You can always go to a website, look up the information, you print it if you have a project or something that you may be, interested in. So this is all the stuff that we have.
Oh,
And
I
in
saw this
different
one. South Asians and lead poisoning. That's more common.
Yes, it is common. Yes. So, within that community, lead is an issue. So yes, we do have some type of outreach. And as you see, there's one of the material actually focuses on that community. Yes. So we have it online and you can always order it from us. You can call us and order, or you can print. This is actually a booklet, so you probably would actually give us a call and order it, for the group to educate it. And this one, I believe it's in Bengali. It's not just in English, it's in Bengali and it's in Hindi. So you could be able to have it in other languages besides English. Okay. So yes, so this is our information line where it is operational from Monday to Friday. You get a live person and just leave a message and one of the staff will actually answer your questions. So that's what our information line is, and this is the number to reach us. And if you can't reach us, you just call 311 and they will direct you to us. Okay, so here are some resources I have for you that you can always check. Information on lead poisoning prevention. Here's the link. Our hazardous products information. We just had a press release about ceramic ware. I'm not sure if any of you've heard of it, but here it is. You can always go on there and check it out and see, you know, if you have questions about what's there. We also have our Healthy Homes page where you can also check out all the different Healthy Homes topics. We also have webinars. I'm sorry, let me move back. We also have topics, presentations that's open to the community, and you can always go on the site. You can join, you can sign up and join and learn about the different topics. And it's monthly, and every month we have different topics. Sometimes we have the same topics, but we have different topics within the month that's open. And you do get a certificate for attending. And sometimes we do have it in other languages. Yes. So if you're not already, here is our is a way to connect to the health department. Here we are on social media, and you know we're there on Twitter. You can follow the commissioner. You can follow the health department. This is our hashtag 10, and you can you know reach out to us. So that's my story for the day, and I hope you enjoy the talk.
Thank you, Charlene.
No problem.
So much packed into that. So first of all, thank you for sharing some of your story on how you got to where you are, because that is
Thank
one
you.
of the intentions of the class is to show off all of the potentials that we have in public health. And if we're here in New York City, we need to know about the Department of Health and Mental Hygiene. Curious to know, based regarding the Healthy Homes program and you know, affiliated services, have those been continuing through the COVID era?
So the inspection area was on a little freeze, but now things are getting better. Inspectors are, you know, going in, going out to do inspection. But yes, during COVID, it was a little hard in doing inspection.
So maybe we could dig into that a little bit. I'd love for the students to get a sense of what actually happens in that whole service provision. So how might a case come to your attention to start with?
Okay, so how we actually get a case is, so we focus a lot more on lead. So what happens is a child, you know, any child at age 1 and also at age 2, it is mandatory for that parent to get that child tested for lead. And when a child is tested, information and the provider needs to report it, and they will report it to the state. They also report it to the city, and then what happens? It comes into one of our departments that's actually going to our system and you know triage throughout our case coordination unit, who would follow up, depends on what the child's level is. And also too will directly go to one of the inspectors. Again, if it's within the range, the inspector would have to now speak to the families and finding out how they could be able to go into the home to inspect, because now you know they've found there's lead into the home, and to find out where the source is coming from. The case coordination unit, they will follow up with, again, the parent again, and they will also follow up with the provider, because at times now the child's going to have to be retested, and the whole thing is now finding out where that source is coming from and removing that source from that child's environment.
And what are some of the more common sources that an inspector might find?
So, you know, one, when they do go into the home, they bring a machine, which is called an XRF machine, and they do have to interview the family. So one, they will have to test the walls. As you know, any building built before 1960 is presumed to have lead paint. And if they found there's lead in the home, so now they have to get the landlord involved in making sure that they fix that peeling paint that's in the home. There is a law which is called local law of Local Law 1 of 2004, and it basically says any child under 6 years of age in your home, there's a peeling paint issue, it's the landlord's responsibility to fix that peeling paint in a home. In addition, if say for instance the child spends more than 10 hours, so say for instance you have a child that visits the home and if it's more than 10 hours for the week, also too, to make sure that these things in place, the landlord now has to fix that issue. And if the landlord does not, the health department will follow up with that landlord to make sure that he gets it fixed, and he hires individuals, workers that's trained and certified to do removal of lead. In addition to that, during the interview, the inspectors do inspect for other environmental hazards in the home, so they could check to make sure is there window guards in homes. As you know, there's any child that's under 10 years of age in any apartments in New York City has to make sure that they have window guards in place. They also check to see if there's carbon monoxide, the smoking detector, are they working, if they need to be, place of batteries. And if they have other issues, they may have other flooding issue, they may have mold, so they will assist the families in getting help or direct them to the proper agency for more inspections and to make sure that the problem gets resolved.
As one of our students, Afra, noted, she was familiar with the South Asian pamphlet targeting that population. Afra, do you know why that pamphlet exists offhand?
I think it's because the South Asian communities live in like poor health apartments in which they're exposed to lead, or like.
Well, you broke up a little bit, but I think you were hypothesizing that the quality of the housing might be lower.
And maybe too, keep in mind the spices, that you may be bringing from back home.
So the housing,
like
we can put
customs, like spices.
So one of the things that we can sort of put aside is the quality of the housing. That's sort of a universal problem across New York City. As Charlene mentioned, 1960 is an important year. New York City was actually on the front lines of this one in terms of being early to ban lead paint. The country didn't ban it until the mid-70s.
Until 1978.
Exactly.
18 years later.
There you go. So we were very much on the fore. But of course, there are plenty of extant housing units that were around before 1960, which have old paint. But what I was trying to get at, and what Charlene started talking about, is that there are unique risk factors for certain populations. So within the South Asian community, and other communities, of course, too, I mean, food products that are imported from other countries, unfortunately, can often be contaminated with other substances like
and also skin lightening cream.
So skin lightening cream, that was historically a problem with other metals. I believe, I can't remember which metal it was right now. But the big
arsenic.
Arsenic, thank you, yes. But with lead, one of the big concerns is a product called Kohl, K-O-H-L, which is a makeup, right? It's a heavy black makeup often used around the eyes.
Yeah, a good if you watch football, you see all the football players, they wear it. So that's what it is.
It looks sort of like that, right? Charlene, are there other typical cases that, or actually, I shouldn't say typical, are there other prominent cases that come your way that are a little bit surprising or interesting for us to know about? Besides the typical, lead level in a baby and you find there's lead paint in the walls. Anything else interesting has come up?
So with recently, as I mentioned about the press release, it was, they found about 15 cases that it was not the paint related, but there were other sources, The ceramics, it was among children and adults. So that was the most recent information that I know of, but it was not paint related. It was more the other products. And the ceramics ware was something that they've been using. And these are things that folks actually use. They may have bought it from their country, bring it in, and, eating out of it, drinking out of it, and some of the things that we have to tell families around that is, if it hasn't been tested, to make sure that just use as a display at home, but don't eat out of it or drink out of it. But that's the most recent cases is was around the ceramic ware.
You also mentioned like spices, and I mentioned like whitening creams that contain those type of lead or other metals.
Okay, say that again. I'm sorry. Go ahead. Say it again.
Like you mentioned, like it contains lead and other metals, like spices and lightning creams.
Right. Right.
It could found in those other things. Yes. Yes. It'd be great if you could also, I place on the PowerPoint presentation some links to our hazardous product website where you can actually look at all the other sources. So it'd be great if you can like take a look at it.
Yes, absolutely.
Mhm.
I have a list of questions, but I want to give the students a chance to ask anything they may have on their minds. What
Is
can
anyone interested in joining the health department?
That's where I was going to go next. Yeah. Anyone interested in knowing how to get involved with the DOH? Perhaps in the near future when you finish your.
Absolutely. Do you have a link or someplace that we could apply, or do you have a special in?
There is actually no special in. What I did put on the PowerPoint is there is a website. It's called I think it's New York City Jobs, which is open to all city agencies, not just the health department. And you can you actually have to register for that link, register yourself, and then that's where you will see all the posting of all the city agencies that you can think of. They put up their posting there. It could be weekly, it could be every other day. So if you're interested in working with the city, it would be a great place to also check. And I also shared some information with you about the fund. They also have a career section with different projects that they are working with the health department, within the health department. So you can also take a look at those at their site in the career section. Great place. I've been here for 20 plus years. I won't say exactly how much because it may be too old for some of you. So yes, I've been here. And yes, one of the things, advice I would say when you're entering is as you getting interested in working with the city, look into taking those exams because some of those positions are tied to you getting a permanent job at the city. So being civil service is a great thing. Okay, I started out and I completed and I'm still a civil servant.
Mhm.
Any other questions? Oh, yes. Go ahead.
Cool, thanks. Hey, I was wondering, you mentioned your audience for some of the presentations, like parents, staff, seniors. Do you do education in the schools or to kiddos anywhere?
So we do education everywhere. So we do it in the schools. When the schools ask you, for now it's been virtual. Yes, we reach out to all schools, all levels of schools, and we offered our educational services to the schools. We do churches. With the churches for now, we haven't had any requests, and some just been having those tabling events. So we've been attending those on the weekends, and we do all the different community-based organizations. I always say anywhere that someone wants to listen to, we've reached out.
Cool. Yeah, because I feel like with kids, in a lot of cases, like they may speak English and their parents don't, you know, I just feel like that kids can be great messengers.
Yes, kids could be great. We haven't not done any outreach to young children or the youth, but it's more outreach to a parent or an elder person or just an adult, you know. So, but we haven't been focusing on just outreaching to young children, you know, except when we do talks, you know, like they invite us to a career day event and at a school, you know, so we give the kids some information, you know, about what we do. We tell about the health department, of course. So that's what we've been doing, but no per se as far as targeting like our target audience to just children.
Yeah, it might be interesting, or like maybe teenagers. I mean, it depends kind of on
teenagers, yes.
But teenagers, like, I just feel like I'm always surprised when I meet some teenagers with how much responsibility they have at home, you know? So,
yeah. And the younger kids, they remember more.
that is true. Yeah, amen to that.
Yes.
Thank you.
No problem. Yeah, someone in Justin raised hand.
Hi. During quarantine, when people had stay-at-home orders, did you notice an increase in cases of like lead poisoning and persistent asthma since people were spending more time at home?
So as far as the cases, I would not be able to elaborate more, but I am assuming the answer would be yes. But we also had to do more education because people were staying home more. So we had to give you these messages to, you know, you're home and the children is there with you, but yet you have to keep in mind of the environmental hazards because that's what we focus more on, the environment, what's in your home. So we did a lot. I would say we were very creative. That's how we started doing these webinars for parents. Anyone could just, you know, log on and listen to the talk so to help protect them while they're home. But as far as the cases, I'm sure the cases were low at the time. But I cannot elaborate on cases.
No problem. Thank you with what you did share. I appreciate it.
No problem. Yes. Is there anyone else?
So I have another question. So considering some of these students who might be interested in joining the Department of Health at some point, could you talk a little bit about some of the other opportunities in terms of career paths? So you're on a very interesting one. What are some of the other, you know, places they could end up through the Department of Health? Sort of navigating that organizational chart that you mentioned at the beginning.
Hold on a second. I did something wrong here. Oh, I can see you now. The organization chart was just basically, you can see it's just basically just for you to see if, okay, say for instance, you're interested in education, you know, educating the community. So that's what, you know, there is in some of these departments that's an option for you. You know, you could be an educator, you could, you know, that could be a role. You could be a community engagement specialist or, you know, individual. So that's a role. You could be inspector. So I was sharing with you, like there's different areas within the our bureau here that we have inspectors that goes in the home. So you can be an inspector. So we also have inspectors to, you know, go into the homes to do that. We have inspectors that does food inspection. We have different inspectors in, you know, the health department. So that's something that you can also, you know, consider. You also have individuals who are just interested in data. You know, that's your thing, surveillance data. So that could be an option that you can also explore. And people, you know, there's individuals who are just interested in, you know, being like a project manager, just, you know, overseeing projects or running projects, you know. So there are different things that you can explore. And that's why I shared with you, as you look at the organization chart and look at things that you may be interested in and see where you could actually fit in, you know. Don't hesitate. There's internships. You could go on the health department site. There is a HRTP program. You could just Google it. And it's called HRTP. Google that. and look up to see, you know, when are they accepting candidates as far as working with the health department, you know, so they have to reach out to us. They have to look and to see who needs what, and it focuses on your interests. If your interest is on EPI, you know, so looking to see if there's someone, another bureau that's, you know, does EPI work and they're interested in getting an intern. So doing, you know, working as an intern to see if you do like this area, if this is something for you, you know, you enjoy doing it. There's areas where are you interested in just, you know, the education promotional things, you know, so that's something for you to also consider as I was sharing with you all the different areas, you know, within the health department, and also to my track. So when I first started, I was actually a public health advisor. That's a title, it's an entry level position. Then I became a public health advisor level 2. So there's different levels. Then I became a community coordinator. Then I became a public health educator level 2. Then I went to a 3. So there are levels in certain of the titles that you also will pursue. You know, so, you know, to keep those things in mind. And of course, you know, your experience, education, you know, will, you know, be part of that, your growth. But looking into those internship and see, you know, what you enjoy doing. You know, you're learning the you know, the professor here is teaching you the background. So now applying that, you know, now you have a project to go into the community to find out, you know, how to plan a program. So now with all the stuff that you've learned, now it's time for you to apply it. So that's you know, things that you should be considering. Mhm.
Any other
Eh,
questions from the audience?
Any other questions?
Oh, sorry. I was just a quick thing. I saw like one of the first slides that
Mhm.
it included like violence and suicide prevention.
Yes, that's a program within
That's so interesting that it falls under
environmental health.
yeah, I thought that was really interesting.
But yeah, so we focus on the home. So that's all part of in the home. All these are home hazards, you know. Yeah.
I just thought that was interesting.
Mhm. Injuries in the home. We fall, you know, and these things happen in the home.
Mhm.
And we have one question from our in-person student.
I'm gonna ask, what's your favorite part about your job or about the Department of Health?
Repeat that question.
What's your favorite part about your job?
Favorite part of my job. One, I guess meeting different people. From one of the things I do a lot of is how we actually met. Dr. Cappy and I actually met at different community meetings, meeting different community organizations and seeing the different work that they're doing in the community to improve our health. So that's one of the things I do. I have to say, have that opportunity to actually attend in those meetings and learning what folks are doing. And, you know, I'm always learning, you know, myself, you know, I'm always learning. So that's one of the I think I enjoy that part. Yeah.
It's a nice group of people that you would.
Yeah. And the different, you know, in different, I mean, when the communities I work with, it's all 5 boroughs. So I'm not just working in East Harlem, you know, I'm also in Staten Island. I could be in Queens, I could be in Brooklyn, and it's different neighborhoods. You know, you see the changing of those neighborhoods. So it's interesting.
I had 2 questions I want to sneak in there. One is a very trivial question, but out of curiosity, I remember when I first started my medical training, you know, many years ago, I got to do a visit to one of New York City's lead safe houses, of which I think there were 3 or 4 at the time. And then down to one, I was going to ask. So that one still exists? Is it up by Monty or where?
Montefiore.
Okay.
Yes, there's only one. So just to give you a little background, everyone, so these lead safe houses were there as temporary housing for an individual who has lead in their homes, and there are no other means when they come in to do repairs. There's no other means for them to relocate anywhere else that's lead safe. So these temporary homes were there for people to go to until their apartment is fixed. So we currently only have one, which is in the Bronx.
And are we down to one because we've thankfully reduced our need for it, or because we ran out of money to pay for the others?
It is, to me, it's all the above.
Okay. It's a complex
And I
issue.
think mostly that a choice too.
Right. My second question, so we mentioned the current commissioner, Dr. David Chokshi, and I think many of you have seen him on TV talking about get vaccinated, get vaccinated. Another person of note you might have also seen on TV is Dr. Torian Easterling.
Yes, he's our first deputy commissioner, and he has a very important role in making sure that things are done fairly. You know, he's our equity in chief. And yes, he has been in the news, especially I think there's a recent commercial you've seen with him talking about the flu shot and also, of course, the vaccine. But yes.
And of note, he is a graduate of our preventive medicine program here at Mount Sinai.
Yes, I read that. It's funny you asked me. He is yes, he is.
On to bigger and better things.
Yes. Yes.
So, you know, he's the first person to hold this role of chief equity officer.
Yes. Have you seen in the organization chart where he actually sits in the chart? Right in the center.
Right there, yeah. There's the commissioner, and then there's Dr. Torian. Yeah.
Yes. His previous role was he oversee those. I think I mentioned the Center for Health Equity. So he was mostly stationed in Brooklyn. So those are locations in specific neighborhoods, and their role is to work with the community and whatever issues that they may be experiencing, to getting some education and, try to combat whatever issue is happening. Yes. So that is, yes, now he's in the center of that organization chart.
Could you talk a little bit about how that role has actually filtered through the organization? Like what current projects are going on that relate to his work?
So I would not be able to elaborate on that.
Okay.
But I do know that what has been done is we've been having these monthly town hall meetings. The commissioner's there, and he's actually there, and other, deputy commissioners are there. So let me kind of back up. So yes, you see there's the commissioner, there is the first deputy commissioner, and then within those, all the divisions, the individuals who oversee those individuals are deputy commissioners, who also have assistant commissioners. So understanding the chain of commands. And within those assistants, then you have their directors and, deputies, etc. So as far as I haven't been able to, I will be able to share that information at the moment, as far as to see what changes occurring. But he is there to making sure that things are fairly done, distributed, as far as even staff, and things like that. I mean, I've heard it, and then he mentioned it on the last town hall of things they're considering, making sure that things are spread out, evenly.
Yes, equitably distributed.
Equitably, yes. Mm-hmm.
That's great. Any final questions for Ms. Gordon?
No other questions?
There are so many things we could mention, but we do have a time constraint, so that's a good place to wrap it up. Thank you very much, Charlene, for joining us today. It's always a pleasure.
Always.
I look
I
forward
hope
to
to
seeing
see you soon.
Your lecture was very informational.
Huh?
Your lecture was very informational.
Thank you so much. And if you're interested in learning a little more about what we're doing for the South Asian community, do check our website out. You have my email address. You can always email me. I will direct you to my supervisor who actually does a lot of studying around the South Asian community. I'll put my email in the chat if you didn't have a chance to get it off the slide. And you can, I will direct you to her.
Wonderful.
Yes, so that's my email.
Oh, great.
All righty.
Thanks so much.
All righty. You take care, everyone.
Okay. Bye-bye.
Bye.
Thank you.
Thank you.
Take care.